And welcome back. Have you ever felt like you need a medical degree just to understand your own health records?
It can feel that way sometimes, right?
Right. So today we're going deep on AI and radiology.
Okay, that's good.
We're exploring a potential game changer called ReXplain.
ReXplain, interesting.
Yeah, it's tackling a problem we've probably all faced, trying to decipher those, notoriously complex radiology reports.
Yeah, they're definitely not known for being easy to read.
Okay, so our main source today is this cutting edge research paper detailing how ReXplain can translate those complicated reports into, get this, easy to understand videos.
Videos. Okay, now that's interesting. It's like having a personal medical explainer.
Yeah, exactly. But instead of a rush doctor's visit, you have this virtual radiologist, right? Breaking things down with like visuals tailored just for you.
That makes a lot more sense. And the research actually highlights this problem that patients, they consistently want access to their radiology reports, which makes sense. It's their health information, right? But the language is just,
It's a problem.
it's a huge problem. It's like trying to read a technical manual, honestly.
I was going to say, I tried to decipher a report about my knee once, and I felt like I needed a medical dictionary just to get through a single sentence.
Exactly. And it's no wonder that people get anxious or even misunderstand like crucial information that could even impact their treatment.
That's a scary thought.
It is. And that's where ReXplain comes in. So
Okay.
it uses a few different types of AI to do this incredible translation. One of the key players is a language model, GPT-4, which I think you've probably heard of.
Yeah, it's been in the news a lot lately.
Right. And basically, it takes that medical jargon and transforms it into everyday language.
So it's like having a medical interpreter build right into the system.
Yeah, that's a really good way to put it.
Yeah.
But it doesn't stop there. It also uses image segmentation AI, which pinpoints the exact areas on your scan that the report is referencing.
So you're watching a video of your scan, and as the AI is explaining a finding, the specific area lights up.
You got it.
That's amazing.
Yeah, and to top it off, they even have AI generating a virtual radiologist to guide you through the video.
Wow. So it's not just explaining the report, it's visually showing you exactly what it's talking about. And it's all wrapped up in this more approachable, like human-like experience.
Precisely. It's all about making the experience less intimidating for the patient. You're not just reading a dry report, you're having like a simulated one-on-one experience as if your doctor was right there explaining the results to you in person.
Yeah, I do. It's like bridging that gap between the complex medical information and patient understanding, but in this way that just feels more like personal and approachable. Now, I'm curious, how did radiologists react to this technology? Did they like put ReXplain to the test?
I would hope so. I mean, putting any new system through its paces is key, but especially when we're talking about medical information.
Oh, for sure, for sure. So basically, they took real CT scans and their corresponding, radiology reports. Okay, makes sense.
Fed all of that into the ReXplain system and just let it, do its thing.
Let it work its magic. So it was like a head-to-head comparison then. The radiologist saw both the original written reports and the AI-generated videos.
Exactly. They wanted to compare.
Yeah. So did they think that ReXplain held its own?
They did. They were impressed. They found the ReXplain videos to be accurate, clear, and like incredibly helpful in, understanding the information.
That's awesome.
Yeah. And one thing they really loved was how the system presented the information visually.
Right, because we were talking about that image segmentation, right?
Yeah.
Highlighting that exact spot on the scan.
Exactly. And the radiologists, they said this visual comparison, it made explaining the findings way more effective, especially when they could show like the difference between a healthy scan and one, with an abnormality.
Oh, I bet. Like seeing is believing, right? It makes it much more real than just those, kind of abstract medical terms.
100%.
Do they have any thoughts on the AI-generated radiologists? I'm very curious about that.
Yeah. It's funny you should mention that because the radiologists were actually very positive about it.
Really?
They described the avatar as, and I quote, natural and conversational.
Wow.
Which is really impressive when you consider that it's AI generated.
Very cool.
Yeah. And they also found that the explanations given were really easy to follow and understand.
That's incredible. And like, I hate to go back to this, but it really does speak to that potential of the technology, right? Like it's recreating that human touch, even in a digital format.
It is.
It could be such a game changer for people who feel intimidated or just overwhelmed in a doctor's office.
Oh, absolutely.
And having that information presented in such a clear way could be really empowering for patients to take control of their own health.
I completely agree. I mean, it's all about making healthcare more accessible and less daunting,
Right.
not trying to replace those, really important doctor-patient conversations.
Of course, of course. But even with all the positives, I'm sure there's some limitations that they found. Did they find anything like that?
They did. Nothing's perfect, right?
Right.
But they pointed out that ReXplain, while it excels at explaining like what a finding shows, it doesn't really delve into the, so what? What does it mean?
Okay, so it's like telling me there's sprinkles on the cupcake, but not telling me if the sprinkles are, sugar or salt.
Yes, a perfect analogy.
You need that context, to understand what it means for you.
Exactly. So, for example, ReXplain might explain that you have, let's say, a nodule in your lung,
Okay.
but it wouldn't necessarily go into like, what are the potential implications of that? What are the next steps? What does that mean for your overall health?
Right. So it's like getting the pieces of the puzzle, but not the full picture.
Yes,
You really do kind of need both. Did they mention anything about how to bridge that gap?
they did. They acknowledged that integrating information about the potential implications and next steps would be like incredibly valuable.
I would agree with that.
Imagine if the video, it not only explained your scan results,
Okay, yeah.
but then also gave you some guidance on what questions to ask your doctor or even like what lifestyle changes might be beneficial.
That would be amazing. Really, it would empower patients to have more informed and productive conversations with their doctors.
Yeah, exactly.
So they at least recognize the need and like the potential there. So that's really good.
It is. It's definitely a step in the right direction.
Now, I want to see this in action. Do you have a real world example of how a traditional report might be different than the ReXplain video?
Yeah, the study actually provided a really compelling example using a case of, potential COVID-19 pneumonia.
Oh, wow. Yeah. That's super relevant, especially,
Especially now.
especially now. Okay. I'm ready. What were some of the key differences?
Right. And in that situation, clear communication is just, it's everything.
Oh, absolutely. It's crucial. And, this example, it really shows the distance that ReXplain can make. So the traditional report in this case, it was classic information overload.
Okay.
It was so long, went into all this granular detail about every single organ, even the healthy ones. And it was just like, full of medical jargon and abbreviations.
Oh, I can only imagine. It's like you said, reading a foreign language. It is. And that you compare that to the ReXplain video, which just gets straight to the point.
Yeah.
It honed right in on the positive findings, specifically the signs of potential COVID pneumonia. And the AI, it translated all of that complicated language into just plain, simple English.
Yeah.
And the visuals, highlighting exactly what the report was talking about.
So much easier to understand, especially because, in a situation like that, you're probably a little anxious anyway.
Of course, of course.
Having that clarity, I mean, that's invaluable.
It is. And it goes back to that visual comparison we were talking about, right? So in this case, the video actually showed the patient's scan side by side with a normal healthy scan.
Oh, wow.
So you can instantly see the difference.
That's amazing. I mean,
Yeah.
it's like that saying, seeing is believing. Takes those abstract concepts, and makes them real and understandable.
It really does. It's like, what's a good analogy? It's like the difference between reading a recipe and watching a cooking show.
Ooh, I like that.
Suddenly you're not just trying to follow these instructions, you're actually seeing the process unfold before your eyes.
Yeah.
And it just clicks.
Exactly.
Okay.
Okay, so this really does feel like a game changer for patient empowerment.
It really does.
Putting that information directly into the hands of the people who need it most, right?
Absolutely. And, while there's still some work to be done, the potential here is huge. Imagine a future where this technology is just like widely available and everybody, regardless of their health literacy, can fully understand their own medical information.
That would be amazing. Sign me up. I want to live in that future. So as we wrap things up here, what's like the one key takeaway that you want our listeners to remember from this deep dive?
I think the biggest takeaway is this. ReXplain, it's not just about making radiology reports easier to read. It's really about transforming the patient experience as a whole.
Okay.
It's about empowering people to be more like active participants in their own healthcare journey and, armed with knowledge and understanding.
I love that. So it's taking something as like complex as medical information and making it clear and accessible and even, dare I say, a little bit engaging.
A little bit. Why not?
Why not? Right. We'll be sure to link to the research paper in our show notes for anyone who wants to kind of delve a little deeper into this.
Definitely worth a read.
It is. And for all of our listeners out there, we'll leave you with this thought. How do you think this technology could change your healthcare journey? Until next time, stay curious.